Okay, so we all know that the Arizona summer can be brutal on our bodies, from dehydration to skin cancer. There's a lot to be cautious of, but are you aware of what it could be doing to your heart? And if you're not, you should be. So we've got the expert here. We've got Dr. Steve Firemelt. He's the Director of Lifestyle Medicine at Optimal Heart Center in Scottsdale. Thank you so much for taking some time for us today.
Thanks for letting me be here.
So we were chatting a little bit before the segment about, you think dehydration, you think of some of those other ailments, but you don't necessarily think about heat and your heart.
Yeah.
How do those two go together?
Yeah, they're interconnected, because what happens when we get hot, when we're out in this 100+ degree weather, our body's trying to acclimate to that. So what we do is try to get water from our bodies out to cool us down. And so how we do that is by opening up our vessels to allow more. So our heart has to automatically pump harder.
Wow.
Our blood pressure can go down. And if we already have some issues with our heart, it can be very detrimental to you.
Yeah, so certainly not something that we want any of you out there to experience. So what can people do? I know you brought lots of props here. How can people kind of make sure that they're looking out for their heart health, especially during this heat?
Yeah, well, we always hear about water as being so important, and it is so important.
Yeah.
But do we realize that most people have not only one of these 5-gallon jugs, but 2 of them in their body? The average person will be having that much, and just a small amount of water loss can be extremely hard on the body.
Yeah.
So keeping that in mind, we sweat, if we're outside in the heat, probably about a quart an hour. That's a lot of water we have to replace. So things you can do is use a Camelback is a great idea, because it's right on your back. Find your favorite water bottle and always have it full. If you're sitting at a desk too, always have your water bottle with you. But especially with heart health, because your blood pressure is going down, you want to make sure that it will help keep your heart strong.
Yeah. I noticed you brought some food and some fruits and other things as well, so it goes beyond water. There are other things.
So you can also, when you eat small meals during the summer, not big ones, better for digestion, and having fruits, vegetables, things that have a lot of water in them is helpful, so having breaks during the day. So when you think of the average person, you think, oh, what should I have? What amount of water?
Yeah.
If you take your weight and divide it by 2. So if you're 150 pounds, you divide it by 2.
Right.
That's 75 ounces. So the average person, when you look at a water bottle, is 1, 2, 3, 4, almost 5 of these.
And you look at that and you think that is so much water, but it puts in perspective that a lot of us probably aren't drinking enough.
No, because sometimes we try to replace it with this, and there is 60-some grams of sugar, which slows down the absorption of water. So you could think that you're drinking a lot, but it's not sucking that water out of your stomach, it's staying in there. So again, heart health, it's very hard on your heart when you become dehydrated and you have to pump and work harder.
Yeah, I know we only have about 30 seconds left. I know you mentioned the clothes. You wanted to make sure we mentioned clothes as well.
Yes, with the clothes, light, airy clothes, not real dark ones are the best, ones that are breathable. Wearing a hat is very important. Sandals are a good idea, because you lose a lot of your heat in your feet. And
real quick, if someone out there, maybe they have some heart issues already, or they're hereditary, run in the family, do they need to take extra precautions beyond just water and making sure that they're dressing appropriately? Yeah, they are at a higher risk if they would, but they should really be tested of their genetics, because then it would tell if they're actually at a risk, or if it's just implied by family. All right, some great information. Thank you so much for coming out today. We appreciate it. And this is certainly timely. Justin, Iris, it's hot out there and humid today too.